Welcome to Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean in association with Winchester MRI, Immune Active Denk, and Almighty Studios. I am here with the hilarious Dr. Paula Dawson, consultant physiatrist. Doc, why you laughing?
Me hilarious?
Yes, you are.
No, nobody no funnier than you, Alicia.
Really, no.
Hi, Alicia. Hi, listeners.
I don't know why we're laughing, you know. It's just
before we came on, we were talking about something interesting.
We will not share that on the air. Please remember to check out our social media pages. Instagram is Rehab Institute Caribbean, Dr. Paula Dawson, and Alicia Taylor Music. On Facebook, it's Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com, as well as our YouTube channel.
So if you missed the first season,
go on YouTube. We're there at Rehab Caribbean.
Yes,
excellent. Now this week we're going to be talking about stroke rehabilitation. Yes, I don't know why we're laughing.
No, but we have to serious up ourselves now.
Okay, so we're going to be talking about stroke rehabilitation, specifically a hemorrhage and ischemic stroke. Did I get that right?
Yes, you did. Hemorrhagic and ischemic.
What we did say?
You said hemorrhagic.
Oh, okay. Yeah, hemorrhagic and ischemic stroke. So where do we start? I mean, I'm aware that a number of persons in Jamaica have suffered or are suffering from a stroke. And so they're in need of rehabilitation.
Yeah. Right, so let's talk about stroke. What is a stroke? So a stroke, as it relates to the brain, is decreased blood flow to a part of the brain, whether as a result of narrowing of the blood vessel, like it block up with a clot or something, or like a blood vessel bleeds, ruptures, and so the blood can't get to the area. So essentially a stroke is injury to the brain, where the brain doesn't get the blood supply, doesn't get the oxygen, and it dies. Because the brain needs oxygen, and it needs continuous blood flow. And that, which is why we talk about hemorrhagic stroke, where there's a bleeding stroke, and there's ischemic, which is a dry stroke, and occlusion stroke. And someone said, what do you mean if there's blood, you know, how does that happen? And I always tell somebody, say you live at the top of a hill, and there's a pipe carrying water to the hill, and the pipe bursts down the bottom. What happened to the people at the top of the hill? They get no water. And so what happens in the brain, if there's a rupture to the blood vessel, there's no blood going to parts of the brain, and then you get decreased blood flow and you get decreased oxygen, you get a stroke, unfortunately. And with an ischemic stroke now, you have two types where the clot could be formed right there in the brain from different reasons. For example, you have something called atherosclerosis. Yeah.
Okay.
Yeah. Right. And that you can actually get all over the body. In fact, that is what causes heart attack, which is, it's really hardening of the artery, Jamie. Hardening of the artery, where the blood vessel, you'll get plaque build up, cholesterol build up inside the blood vessel, and then it makes a lumen, which is the passage of the blood vessel smaller, and it occludes or prevents blood from flowing. Right? And so with ischemic stroke, you may get a clot, which is formed in the brain, or you may get a clot that comes from somewhere else.
Really?
So the clot could actually come from the carotid artery.
Yeah.
Because the carotid artery might have atherosclerosis. So anytime, so the inside of the blood vessel is supposed to be nice and smooth, so the blood can go through smoothly. But anytime when you don't have good health practices and you develop atherosclerosis, it gets very irregular. You have plaque buildup, and in those little streaks, literally they're called streaks in medicine, you can get clot buildup. So,
okay, thank you for that. But I've heard that you can have a clot, and that spreads to a part of your brain. Is that possible?
No. No. Okay. You're absolutely 100% correct. So you could actually get the clot in the carotid artery, and it goes to the brain, or it could be in the heart. So, all right, so
what about if it's like in a different part of your body, like your leg?
No.
It has to be in,
right, a clot from your leg cannot get to the brain.
Okay.
Because
some people say that though, you know.
No, it can't. Reason being, it can go to your lungs.
Oh.
It can get up what we call, so DVT, deep vein thrombosis, that you can get in your leg. We'll actually do DVT, deep vein thrombosis. Thromboembolism, we'll talk about that. Thrombo, clot, embolism, it moves. Embolize means to move. So we'll do that at one point. But you can get a clot in the leg, and it will go through one side of the heart, and then it will go to the lungs. but then it cannot get to the brain. Why? Because it's like almost like, so the peripheral blood will go to the right side of the heart and then up in through the lungs and then back into the heart, where it's then pumped to the rest of the body. Now, the clot will just stop in the lungs. It can't go through to the other side of the heart. There's the left side of the heart which pumps the blood to the rest of the body. All right? Okay. The clot that you get can be from the heart. Now, so for example, we're going to talk about cardiac rehab. If you were to get a heart attack, God forbid, and the wall of the heart isn't moving, anywhere there's stasis, where blood is not flowing properly, which is why you get clots in your leg when you fly from Jamaica to England, because you sit down for long, and you get clots in your leg. If you're not active, that's when you get clots. If you have a heart attack and the walls of your heart isn't moving properly, you can get a clot in the mural, which is the wall of the heart. Or if you have something called atrial fibrillation, where you have irregular heart rate, it can form a clot. And those clots can go to the brain. So ischemic clot.
Is that another thing called palpitations, or is that a different thing?
Palpitation is just an irregular heartbeat.
Oh, okay.
Right? But fibrillation is an irregular heartbeat, but it's continuous. So you just have a little palpitation, get a once, keep heartbeat, and you're fine. Right. Okay. Right. So it's not, if you have a palpitation, it's not atrial fibrillation. Okay. And then you have atrial flutter, that's another diagnosis. Right? But we'll do cardiac rehab, we'll talk about those things. Okay. Right. So this kind of sounds confusing, but essentially a stroke is decreased blood flow to the brain. Okay. Either as a result of a clot formed in the brain, or a clot coming from somewhere else and blocking the blood vessels in the brain, or a blood vessel bleed in the brain. A blood vessel can bleed in the brain if your blood pressure is too high, uncontrolled. Really? Yes, ma'am. Or if you have something called an aneurysm, a berry aneurysm, like berry on the tree. But there's a part of the brain called the circle of Willis, which is the highway of the blood vessels in the brain. And you can get a berry aneurysm, which can be congenital. You're born with it, and then it ruptures. So you can get a berry aneurysm rupture, or you can get a blood vessel. So people with hemorrhagic stroke usually have high blood pressure, and they get a stroke when they're very, very excited, agitated, stressed out. You hear a story where the car breaks down and the man is in the engine, and then you feel one side of the body, or he gets really upset, right? Whereas an ischemic stroke, sometimes they wake up with it, and they wake up with one side of the body weak. And so clinically, what happens? Wherever in the brain the decreased oxygen issue is, that functional, whatever that brain does, whatever the area of that brain does, you'll have decreased function. In that area? Wherever it controls. So if it's on the right side of the brain controls the left side of the body. The right side of the brain controls the left side. You never know that. No, I never know that. That's so cool. It decussate. Another big word. And the left side controls the right. And the left side controls the right. Interesting. Right. With the exception of the face, which are the cranial nerves. It kind of mix up, right? So the left side of the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. And so you may have a stroke affecting one arm, one side, hemiplegia, hemiparesis. That's why people, right? Between one side is there. You may have a stroke that affects your vision, occipital lobe. That's the visual cortex. Cortex is the brain. Cortex. You can have a stroke in the frontal lobe, and it affects your personality and your mood. Really? Yes, man. I mean, I get so excited when I talk about stroke. Right. So but what we tend to see are strokes that affect the motor strip. That's it. And so one side. And then you can have stroke on the brainstem. I've had a patient when I was in New York, he had a stroke on his brainstem, which controlled the swallowing muscle. He was perfectly fine. All limbs are good, but he couldn't swallow. And so we eventually had to put a peg, a feeding tube. So a stroke is, to all of that, a stroke is decreased brain function wherever the brain controls as a result of decreased blood flow. And so with stroke, you can have a weakness on one side, lack of feelings on that side, decreased sensation. You can have blindness. You can have loss of balance. You can have bowel and bladder incontinence. You can have problems with swallowing, dysphagia. You can have dysarthria. Swallowing is dysphagia. Dysarthria is articulation. So you have slurred speech. And you can have facial asymmetry, where one side of your face is paralyzed and the other side is normal. I know some persons, after them have them stroke, it don't seem as if they can ever
come back?
You know, I like that question because I really do, because that gives me the opportunity to share the continuum, the spectrum of stroke. So you have something called TIA, Transient Ischemic Attack. Those patients are very fortunate. They get the stroke. They even have one side of the body, zero power or numb. They go to the hospital and it completely resolves in 24 hours.
What?
Transient Ischemic Attack, TIA. Those stroke recover, right? So then, that's the mild stroke. Usually those are from clots, and the clot is tiny. And then the clot just, whatever the medications the hospital, the doctors will give you, it helps to dissipate the clot. Dissolve the clot and you get back function. Right?
Okay, good.
Now then you have, depending on the type of stroke can affect your language. And language has three main parts: comprehension.
Yes.
Right?
Yes.
Fluency. And repetition.
Yeah, okay.
Right? And then you have something called naming, anomia. And so for you to understand what I'm saying, your comprehension centers of the brain must be intact. Right? For you to repeat what I'm saying, your fluency part of the brain has to be intact.
What about the repetition?
You have to be able to. So they actually, look that question. So they actually connect. So one part of the brain, the Broca's speech area.
Oh, the Broca's.
And then you have the Wernicke.
Yes,
and then you have the arcuate fasciculus. And so when there's a stroke affecting the nerve between those two, then you can't repeat. So you can understand what I'm saying, but you can't repeat it because you can't connect.
That's an aphasia. Okay, what
That's
about
an aphasia. Language disorder is aphasia. So it's a disorder of language, not articulation. That's what aphasia is.
Okay.
So comprehension, fluency, and repetition. And then you have anomia, where those patients they can trick you because they repeat, they comprehend, and they are fluent, but ask them, what is this? Hold up a pen. I say, what is this? They can't name it. So it's anomia. There's another part. There's a part of the brain that they can do everything, but they can't name. So stroke is so complex. There's another part of stroke where deep stroke in the basal ganglion can give you a completely different picture. You can have sensory only. You can have one arm only. You can have. It's just incredible. I mean, stroke rehab is one of those things that I love to do because stroke patients can recover, right? Depending on the degree of the injury.
Okay.
The last type of stroke that I didn't mention is global.
Okay.
Global, where like one whole hemisphere might be affected. Okay. And so those patients are usually bedridden. So how much you recover after a stroke, in stroke recovery or stroke rehab, is dependent on a few things. Okay. And we can get into that a little later.
I believe we should and we will. This is some good stuff. But we're going to take a break. When we get back, we can talk about rehabilitation.
Yes.
Stuff like that. Stay with us. Welcome back to Rehab Now. If you're just joining us, we're talking about stroke rehabilitation. And I was saying to Doc how very intricate the brain is. And she was telling me about how it affects, when you have a stroke, how it affects your comprehension and your language and your insight and stuff like that. So just talk about that a little bit more.
Right. So the stroke, I mean, stroke is such a huge topic.
Yeah.
And we can go deeper into stroke if you want, and then we can do stroke rehab afterwards.
All right, let's try.
But let's see what we can get through today. Right. And so as I mentioned, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. Now, the dominant hemisphere is usually the left side of the brain.
Strong side
In most people, not everyone. And that is where you have language as well. And so if you get a stroke on the exact same area on the right side of the brain and the left side, is a completely different syndrome. Stroke syndrome in terms of language.
All right.
In terms of language. So you might get the same left hemiparesis, left weakness in the arm and leg, or right? Depending on the side of the brain. But if it's the same location on the left, you get aphasia, as you mentioned before. So it's comprehension issue, fluency issue, and comprehension is understanding, receiving. So the thing, you have Broca's aphasia. Those people have difficulty speaking. They can fully understand. Some stroke patients, and I know you guys are hearing me, you fully understand everything, but your fluency is affected. That's Broca's aphasia.
So for example, they would say something like book table,
right?
Meaning two books are on the table. No, or is that the next one?
That is probably when they're improving. That's probably when they're improving. So Broca's aphasia is they fully understand you, but they're trying to say something. They know, but it just can't come out, or it comes out in a different way, right? Now, Wernicke now is Wernicke. They're very fluent. In fact, they can have word salad. They call it word salad. So you ask them something, they don't have a clue, and they're talking, and they're talking, and they're talking, and they're talking, and they're talking. So they're happy in a sense because they do not understand what's going on. Sometimes, right? So with a Wernicke, so comprehension is no longer intact. So Broca's patients are fully comprehending everything that's going on, and so people be talking slow, right? And they're just understanding. Their memory can be still intact. It's just their fluency and their repetition. All right. Now, when the same location stroke is on the right side, your language is intact because those are the language center. But on that side, now you have insight issues and neglect. What do I mean by that? So they neglect the left side of the body. So literally, I mean, in stroke rehab is so amazing. You ask them to shave, and they shave one side of the face. They neglect the entire side. They're walking, and they'll hit up the left side of the body in the wall because they've neglected right. So the brain doesn't recognize one side. You ask them to draw a clock face, and they put the numbers only on one side of the clock. Yes. You draw a line, and you tell them to cut the line in the middle. They'll cut it to one side. More to the right, so it's hemi-neglect. And they have insight issues. So the rehab, so they can't understand as much the insight on their impairment as much, right? But the thing is with stroke rehab is so wonderful. Stroke patients can recover depending on how much brain is injured, but time is the essence. So before we get to rehab, I just want to mention some other type of stroke. So if you have frontal lobe stroke, that's where your personality is. That's where initiation is.
I want to know about...
That's where your motivation is, your mood. So if you have frontal lobe stroke, you can be depressed. You can have... you can go from depression to manic to happy.
Are you kidding
right.
me?
It can affect you become disinhibited. Like men, when they're being treated by a female therapist, they get inappropriate. So you just have to redirect them. And they can't help it sometimes. You know, they may try to reach and touch you on different parts of your body, but it's because they're disinhibited. The inhibition centers in the frontal lobe.
But I mean, is it obvious that there's something wrong, or just...
That's why we bring on a neuropsychologist. You know, so the clinical examination and the history from the patient's family and even from the patient will help you to say this is... And then the MRI will show you from...
So chances are, of course, right? No, I'm sorry,
You're so fascinated.
Yes, I am.
Love stroke. I love stroke patients. They do so well. If you treat them, the rehab is there.
All right. So what I want to know, chances are, God forbid, I could get a stroke. That stroke you're talking about,
the inside one,
the
right
inside
side
one, and my behavior changes, and I don't
frontal
know.
lobe, yes,
frontal lobe,
absolutely.
and I don't know that I got a stroke.
Absolutely.
And people around me just see the behavior and say like, oh.
And I'm glad you brought that up because I had a patient once. Well, not me, when I was training overseas. And the husband, an older guy, brought in an old lady, and she says, you know, her libido has changed and personality changed, and you don't know what happened to her, no weakness. And when they did the MRI, she had a tumor in the brain. So not only stroke can change your personality, you can even have an infection in the brain, you can have anything in the frontal lobe that affects the personality center, your mood, as well. So, I mean, stroke syndrome is so interesting. And even occipital lobe in the back of the brain, where you can have stroke there, we have cortical blindness. Meaning cortical blindness is where they will tell you they can see, but they're not seeing. So they're having visual impression of what is there. So they're seeing. So like when someone is blind, I believe, they don't see anything. like a black or a curtain
That's
across
what
the
I
eye.
think. That's
but
what I
with
think.
cortical blindness, because the eyes are intact. So blindness is usually an issue with the eye, where the light doesn't go through or the light doesn't register on the retina in the back, and then the signal doesn't go to the brain. So that's where you get. But these people, they can actually see things. So they get cortical blindness, where they actually tell you, where you hold something up in front of them, can you see this?
And I would say yes.
Yes, but then it ask them what it is, they're telling you something else. Whoa. And so you get imagery. They actually see. Like seeing is seeing what's around you because you're not seeing black. And so they'll tell you, I'm not blind, I can't see. So you get cortical blindness. And then you can go down deep into the brain and you get basal ganglion stroke, where, I mean, it's so amazing. And then you can go into the brainstem, where it controls different parts of the body. So, for example, there's a part of the brainstem called the pons. Pontine stroke can give you locked-in syndrome. I don't know if you saw this movie, Kill Bill.
I never watched it.
Okay, sorry, Kill Bill. So Kill Bill, so first of all, no one can be in a coma for how many years and then get up and kill everybody. That was
That's ridiculous.
Right. However,
ridiculous.
So with a pontine stroke, there's a lady by the name of, I think her name was Shrivo. I can't remember, I should have looked it up. But her husband, she had a pontine stroke for years, and she could only blink because she understood everything. But the stroke in the pons, locked-in syndrome is called nothing below, in terms of no arm, no bowel function. But of course, the heart and breathing can be independent, because that's autonomy. And so if you ask them to answer you, and they'll blink. So
that's all they can do.
That's all they can do. Do you understand me? Yes. And if you ask them to use their eyes, and some of them can, even with the technology, they can look at words on a screen and they can talk. So they use a computer, so they'll look at where the eye is going, and so you get a voice from them. And so you have brainstem stroke. You have brainstem stroke that can affect only hearing, can affect breathing. I mean, it's just amazing different types of stroke syndrome that you can get.
So all right, so you say you have one that can affect your breathing.
It affects your breathing, you're dead. Because it affects the breathing center. Yeah, man, it affects the breathing center. And so you can have stroke to the point where it controls the ventilatory center. So heart rate and breathing, you can't stop yourself from breathing.
Yeah, okay.
You can't stop your heart rate, because that's autonomic. That's an autonomic nervous system. But you can't stop yourself from moving your arms. Yeah. Right. And so the parts of the brainstem that controls, heart rate and breathing is in the brainstem. Right? And so, yeah, it's amazing. So let's talk about stroke rehab. See, the wonderful thing about stroke rehab is the brain can recover. There's something called neuroplasticity. But when I went to medical school, that was 19, long time. I finished med school at you in 2020, 22 years ago. Can you imagine that? And, back then they were, internationally they were telling you that the brain doesn't regenerate. Now we found that it can regenerate depending on the injury. So the brain goes through something called neuroplasticity, where it can recruit other areas to take over the action, but not every stroke syndrome can do that.
Right. So
the brain has a lot of redundancy. So you may have one level that can move the right hand, another level that can move the right hand. So when one area is taken out, the other area takes over. So that's called neuroplasticity, collateral sprouting, diaskesis. Those all fancy words. Just say the brain, the nerves can reorganize. But the best thing is it can only reorganize if you tell it what to do. Okay. Which is why stroke rehab is important.
Tell me how we tell it what to do.
I love that question. And so functional rehabilitation. Yeah. So if you want to teach the body to pick up a cup, teach it to pick up a cup. Which is why stroke rehab is so fascinating. So, I mean, in let's go high end now and then come back to Jamaica. Right. You can have these electrodes that you put on the arm to connect it to the action, to open the fingers, pick up a cup, and then after a while, so you have to do what you want to. You have to teach the brain what you want to do. It's called massing, mass action. So when a stroke patient, sometimes they one side might be a little bit weak, and then they just stop using that side. They can't bother because it's weak and use the other side. The thing with stroke rehab, you have to do functional rehab during the time of neuroplasticity, and that's between 6 months and up to 2 years.
Okay, because After that, it's like you close, the window closes.
Right, the window closes. So time is essential. Time is essential. So you have to teach the brain what it needs to do, and which is why physical therapy, specific functional rehab is essential.
And what if you get the stroke, God forbid, and you don't do anything really?
Well, the brain will just develop in a state where it is not challenged. It is not challenged, and you just won't have function, because you have to take advantage of the reorganization. And once it heals, it heals. Now, not every stroke will heal to full recovery.
I can imagine.
Depending on the first insult from the stroke.
What about the one with the right?
The frontal lobe?
Yeah, you don't know about it, but you leave it.
You see, that's the thing. You see, frontal lobe, so comprehension is important for rehabilitation. So if you don't have the insight, it's difficult. But the skill, like a neuropsychologist, so the frontal lobe stroke is more personality. It's you have mania, you have depression, you have disinhibition. A neuropsychologist will help to kind of train them back again. In that instance, you don't need a physical therapist if you don't have any motor dysfunction. Neuropsychologist, But stroke rehab is fascinating. The key to remember is stroke rehab is important. Soon after the stroke, the main thing that kills you after a stroke is another stroke.
Yes.
So you have to control the blood pressure or issues.
So with the
we should probably continue stroke.
I know we should.
We have to talk about causes, risk factor.
So many things, because I want to know, would the rehab help to prevent another stroke? Do you know what I mean? Or
no,
or we can't. Okay,
that would have to expand on.
Okay.
So we can continue next week.
All right.
Let's continue stroke next week.
No problem. All right. Sorry, that's all we got time for. Thank you for joining us. Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging, immune active DENK, a combination of key active ingredients designed to boost the body's natural defense, and Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve. Thank you, Power 106. Thank you, show producers, engineer, everybody, listeners. Love you. Bye-bye.
Love you too. Blessings.